Hi, my name is Akash Patel. I'm a consultant trauma and orthopedic surgeon. I work at the Royal Free London NHS Trust, and today we will be talking about knee replacements. Now, the first question I get asked by patients is what exactly is a total knee replacement? So, a total knee replacement operation involves removing the worn out bone and cartilage and putting in a brand new implant. This implant consists of different components, which include metals, a plastic liner in between the two metal bits, and cement to hold the metal bits onto the bone. Now, the other question patients ask is, when should I have a knee replacement, or what are the indications, I should say, to have a knee replacement? So the biggest indication is pain. So when patients are in severe pain with lots of swelling, stiffness, and they're really struggling with walking, knee replacements are an option, and usually they are good options in the correct patients. We always start with non-operative treatments first. So non-operative treatments depend upon what the problems are. And the biggest cause or reason for knee replacements is osteoarthritis. Osteoarthritis essentially means wear and tear around the joint. So the cartilage can degenerate, and that can lead to pain, swelling, and stiffness. The non-operative treatments for osteoarthritis, we always suggest to our patients in the first stages are things like physiotherapy, because that helps with building the muscle, improving the range of motion, improving the balance of the knee. Second thing we talk about is painkillers, which help to reduce the pain and the inflammation. Third thing is lifestyle changes. So eating properly, drinking properly, watching your weight. Next thing we add in or consider are injections. These, of course, are temporizing measures, and they don't really reverse the osteoarthritis. And if the patients have failed or not progressed well with the non-operative treatments, then we consider knee replacement surgery. Next question I get asked by patients is, what do we do? How do we go through the process? What is the assessment? What does it involve? So usually what we all do as doctors, we undertake assessment by taking a history. So we go through some medical background questions, we examine patients, and then we organize an x-ray. The x-ray shows us the degree of arthritis in the knee, which then helps us with planning for knee replacement surgery. Once patients have made a decision to consider a knee replacement or total knee replacement as part of their treatment, then we organize something called a pre-assessment, where one of the nurses undertakes a blood test, maybe a heart tracing, to ensure the patients are fit for an anesthetic. So this is really important because the anesthetic doctor undertakes another assessment with the patient, and we talk about either general anesthetics or spinal anesthetics. Patients usually come in the morning. The operation can last 1 to 2 hours. During the operation, we remove the worn out bone, the worn out cartilage. We implant the artificial metal, the plastic, and the cement. The patients, we would like for them to start moving the knee as soon as possible. So we'll get the patients up and about walking straight away, less than 24 hours. Patients are mobile and usually discharged within approximately 24 to 48 hours. It takes approximately 2 weeks for the scars to heal. And then after the surgery, the key factor to consider is the rehab. The rehabilitation is really important. So this involves more physiotherapy, more painkillers, lots of ice, good nutrition, must take lots of fluids, lots of fiber. And I always say to my patients, you're not going to like me very much for the first few weeks, because initially knee replacements are painful, but they get better. Again, the first 6 to 12 weeks, the knee is swollen and sore, can take up to a year, but usually knee replacement patients are better before then. The physiotherapy is very important because we must get the knee moving. Otherwise, what happens? It becomes stiff. Next question patients ask, what are the benefits? What are the risks? So the benefits, as we mentioned, are pain relief. That's the main thing, really. And the risks for any surgery: bleeding, infection, swelling, stiffness, scars, blood clots, heart lung problems, anesthetic risks, damage to some of the other structures such as nerves, ligaments, loosening of the implant. But again, these risks are small, and most patients who have knee replacements do well. But we always talk through the benefits versus the risks before the surgery, and also we keep a very close eye on our patients to ensure that they do well. The long-term goal is to get the patients walking, moving, and improving their pain, and a lot of this does depend upon the progress with the physiotherapy rehabilitation. So even before surgery, we emphasize physiotherapy, as well as after surgery, we emphasize physiotherapy. The other important thing to consider is, of course, why patients have knee replacements. So we did say pain. The most common reason is pain secondary to osteoarthritis, which is degeneration of the cartilage. The other things that can happen, that can lead to osteoarthritis, so sometimes patients have injuries to their knee, so patients who've got damaged bits of cartilage, such as the meniscus, which is a bit of rubber, or if they've had fractures around their knee, this can potentially increase the risk of osteoarthritis and knee replacements. Overall, knee replacements are good operations if they are done in the right patients with the right hands. And most importantly, knee replacement surgery is an option for patients' treatment. So we never say to patients, look, you have to have it. This is usually a patient choice after an appropriate assessment and discussion of benefits and risks.